Facial feminization surgeries are often pretty invasive, and with that comes the not-so-fun recovery as the swelling and bruising subside. Based on my experiences with FFS and a little bit of what exists out in the research, I wanted to share a few tips and bits of info that will hopefully be helpful for anyone out there who is considering FFS. I can't believe it's already been over 3 years since I got a few facial feminization surgeries, and I say it like that because facial feminization surgery can refer to a bunch of different surgeries. But today I'm going to primarily focus on what I actually have had done so far. Things like contouring and shaving of the jawline, contouring and shaving and reducing the brow bone, and advancing the hairline. Based on what I went through in my recovery process, knowing a few things in advance may have helped in terms of setting expectations and making the process more manageable. Not enjoyable, but more manageable. So I'll start with recovery primarily related to, surgeries of the brow ridge and hairline. Know that you will swell up like a balloon, and it will likely be at its worst, 1 to 2 days after surgery, not immediately after surgery. Your doctor will likely give you a sort of recovery regimen that may involve like compression bandages, multiple ice packs that you put in different spots to help reduce swelling. And I was wearing ice packs throughout the day for I think at least the first week. And yes, I said wearing ice packs because they would slip into different spots of the bandage that would be wrapped around my head. Super fashionable, let me tell you. At the same time, if you get a hairline advancement, know that your hair it'll be a little bit funky for a while because you're not going to want to get that, surgery site along the hairline wet or dirty or anything like that those first few days especially. So you got to be careful with cleaning your hair. You'll also want to be careful because this front part of your head will be numb for months due to the hairline advancement and what it does to the nerve endings in that area of your head. There'll be numbness like all throughout here, and it is quite strange. It's really fucking weird. And since it'll be numb, once you start washing your hair as usual, be extra careful if you use things like hair dryers or other heating tools because you could easily burn yourself and not notice until after the fact because you would be numb. You may also get some scarring along the hairline. Let's see if I can show any of it here. There will likely be some scarring. There's a little bit of scarring for me, maybe a little more than I would have liked, but not nearly enough for me to at all regret anything I had done. Some things can make scarring worse, like going out in the sun. So if you're spending any time in the sun during your recovery period, protect the hell out of this area. And, just stay out of the sun for a while if you can. You're recovering from surgery, for God's sakes. You can tan or whatever later. And now for the big procedure, the jawline contouring and shaving. Woo, how fun. The doctor told me he went to town on my jawline, shaving a ton of bone off, and with that comes, yep, you guessed it, more swelling, bruising, and numbness. Hooray! Fun never ends when you get FFS. And I'm not sure what methods other doctors use, but the surgeon I went with, Dr. Martirosyan, does jaw work by going in through the mouth and going in through the lower gum line. And this completely eliminates the possibility of any outwardly visible scars. Sure, you get some scars in your mouth, but how often are you looking in there? How often are other people looking in there? Is anybody really going to see it? Who knows? Maybe you're doing stuff where people would see that all the time. I can't think of what that would be, but for all intents and purposes, scarring is going to be non-existent for that jawline surgery. But there is a lot of numbness, like I mentioned, that comes with this. So let's put it this way. You should be prepared to be on an all-liquid diet for at least those first 5 to 7 days, if not longer. My lower mouth was so numb that I could not properly chew anything for days. I remember I tried to have some pizza probably over a week after I had my surgery, and it took me 20 to 30 minutes to eat one fucking piece. And that amount of time is not worth it at all. Especially not worth it for shitty Domino's pizza. What was I thinking? Treat myself with Domino's? If I'm going to put myself through pain, I might as well, got something a little bit classier. But I digress. I feel like the numbness in my lower mouth lasted longer than the hairline. It might also just seem that way because we tend to do more with our mouths than we do with our hairlines. Using my mouth multiple times a day to speak, to eat. I brushed my teeth, whatever. There's probably a bunch of other things I could list there. My brain is just... And although the numbness did gradually get better over time, my lower mouth was at least partially numb for probably more than 6 months. You know, it probably took like 9 to 12 months for that numbness to fully subside, or like 97% subside. There's still like a teeny bit of numbness there, but nothing that even remotely impacts like any quality of life stuff. It doesn't impact speaking, eating, drinking, none of that kind of stuff. It's just like, there's a little weirdness there. It's fine. But, you know, most of that numbness will go away over those first few months, and gradually you'll have like those last little bits that take quite a while to heal. And as for swelling of the jawline, there was a ton. Let's just say for several weeks, it looked like a giant bee stung my chin like 50,000 times. Just let it swell up, and my face again looked like a balloon in this area especially. And don't just take my word for it. Let's reference some research out there to see what other people's experiences were like. In a 2016 study, Raffini and colleagues surveyed 33 trans women who had at least one FFS procedure done, and it included things like jawline shaving, contouring, rhinoplasty, brow bone contouring, reduction of the Adam's apple, and so on. They find that all of the trans women in the study reported significant improvements in quality of life following surgeries. Probably no surprises there. And the majority of the swelling, like very noticeable swelling, was gone by 2 months for most surgeries that were performed for most of these individuals. And then in a 2020 study involving FFS procedures with 220 trans women, Selene found that a majority of the numbness in the jawline subsided in the 1 to 2 month period. And scars from hairline advancement surgery typically resolved and healed within 3 to 6 months. Tulane interestingly recommends a 2-stage approach to FFS procedures for individuals who are getting multiple procedures done, with the first stage kind of focusing on the upper half of the face, so like rhinoplasty, you know, anything with the brow ridge and eyebrows, hairline, that kind of stuff. And second surgery at a different date, focusing more on the lower half of the face, so things like, you know, your jawline, Adam's apple reduction. I haven't heard of this 2-stage approach before, but I mean, it makes sense in terms of like kind of doing more of a sequence approach to the surgeries you do, so your entire face isn't swollen up like a balloon, which can make just existing much more uncomfortable. I say everything in this video to let you know, be prepared for a long healing process after most FFS procedures, but also know it'll heal eventually. You'll be numb for a while, you'll be swollen and bruised for a while. Most of the very visible swelling will be gone and down after about 1 to 2 months, and any remaining swelling will gradually go away in the coming months after that. Because of this, you won't know 100% how your face is going to look right away. Because, you know, it's still swollen, that's not going to be the final shape of your face following surgery, so be patient. As hard as it may be, give it a few months and you'll have a much better idea of what it's going to look like. I mean, you'll still have like a 75-80% idea, but wait for that swelling to go down before making any, you know, drastic conclusions about how you look. But before I continue rambling on into oblivion, I'll turn it over to all of you now. What did you think of the information I shared? For those of you that have had any FFS procedures, how were your experiences? Any recovery tips to share with anybody else in the comment section? And for those of you that are considering FFS, what are you considering having done? I'd love to hear all of this and more down in the comments below. And as always, Tipsy and I love you all and hope you're staying safe and sound. If you have not done so already, please be sure to give this a huge thumbs up and hit that subscribe button and notification bell. I love you all. Bye for now.